Hello, and welcome back to Aesthetically Speaking. Working out is one of the ways I care for myself as a pro-aging woman. And that's going to be my subject today when I go and chat to Dr. Frances Fleming, a general practitioner who studied at Wits University. She did her internship at Helen Joseph Hospital and studied further in the UK doing ophthalmology. After that, she went to India and she studied yoga, meditation, and the art of ancient healing. Through her years of general practice, she's really honed her skills in metabolic health, in weight management, and in menopause. And her view is that there is no one-size-fits-all solution, as each person is unique. Your journey will be very different to mine, but we could find some commonalities. One area of her practice also focuses on aesthetics. Now, we can't really feel beautiful without if things aren't going well within. Stay with me. I'm going to find out how we can all age with vitality, with energy, health, and power. Dr. Fleming, thank you so much for joining us on Aesthetically Speaking. And as I was saying in the introduction, there's certain common symptoms that we all share when we go through menopause, and understanding that it is a unique journey. Doctor, could you take us through the common symptoms that most women face when they go through this change of life?
I think it's important to know that the change it happens as a journey, and it can span many years, because the average age of menopause, according to the science, is 51. But it's normal to go through these changes anyway from age 45 to 55. And we go through perimenopause for 7 to 10 years before that. There can be an evolution of symptoms and an intensifying of some other symptoms as those years go by. But the commonest ones of menopause per se, and those that, according to the science, are the ones that we should be taken seriously, although there are many more, are hot flushes, night sweats, and genitourinary symptoms that are so troublesome. But you could literally go from top to toe and find symptoms in every system of the body that are caused from the menopause, from brain fog to dry eyes, to dry mouth, to palpitations, to digestive changes, to aches and pains, to depression, and it's endless. There's so many symptoms that happen, but mostly as a result of the decline of the dominant female hormone called estrogen. There are other changes to other sex steroids at this time, but most of the symptoms are thought to be as a result of declining estrogen.
And I'm glad you mentioned ages and the fact that it's an evolution, because I always think about the millennials and possibly the generation that were born after 2000 or the year 2000, and they are having babies later.
Yes.
And going straight into menopause.
Yes. Yeah.
They're raising these little ones, going through their perimenopausal years, as well as perhaps having to worry about aging parents of their own. The stresses of maybe a career or just the normal day stresses of life. The question is that could we start arming ourselves, and could we tell this to our daughters that might be part of that generation, that there are ways in which we can start arming ourselves for what is to come in our 20s and 30s?
Absolutely. And I think it's funny that you mentioned that, because I think that generation of women who are doing it all and looking after generations both above them and below them are called the sandwich generation, or Gen Z, I think. But the sandwich generation describes them better, and they face an enormous amount. And the problem is that I don't think when we're 20, We have a very clear view of the
It's not going to happen.
Exactly. We don't think we're going to decline or that our hormones are going to change. And we don't necessarily take the steps that we might well have done and benefit from that will actually make our process or transition into menopause smoother. But there is no doubt about it that there are things that we can be doing as younger women.
Yes.
And I think with people's awareness now, exercise is definitely top of the list there. And it's about strength training. It's really about preserving muscle condition as we get older. And the other thing is eating well. I think we eat on the fly, especially in those busy lives that you describe.
Whatever your child's left on the plate.
Exactly.
I'll just finish it off.
Exactly.
That's not a meal.
No, it's not a meal.
We're going to get to strength training. But let's talk about nutrition because, for example, you could just shift something like simple sugar and just take that out and go for the more complex and up the fiber. And you've already done some.
You're absolutely right, Paola. And in my practice, even taking that a bit further is the importance of protein, where I find for many women, it's easy enough to kind of grab a sandwich, even if it's a whole wheat sandwich. But what's happening is that we're not getting enough protein. And that's because the guidelines in terms of the WHO are so extremely low. They were actually, I don't know if you know this, but they came up with the number of 0.8 grams of protein per kilogram per day, based on how much protein it is required to prevent you from going into a malnourished state. They were designed for sub-Saharan African people and literally to kind of make sure that the population didn't suffer from malnutrition and need hospitalization. So that number is way too low for optimization and to have somebody thrive in terms of their health. So protein is critically important. But you're right, simple other changes would be just to cut out the rubbish, cut out the sugar, and introduce more complex carbohydrates and try and look after your gut biome. I think everybody's heard of it.
Yes.
And yes, there's yogurt everywhere and there's kimchi everywhere. You can make your own. So to have a little bit of knowledge of those things and to even do it from time to time is really invaluable.
Amping up the protein, cutting out sugars, calcium, vitamin D.
I think, in fact, there was a recent article that came out, published, I read it on Medscape, that said we're overdoing it. We shouldn't be testing and we shouldn't be replacing vitamin D in so many people. But I can tell you now that when it comes to women and aging, I think there's an exception to be made here. I think we all need to test rather than just randomly replace. Vitamin D can become toxic at high levels. It's a fat-soluble vitamin. I think you need to know what your levels are. And mine, for instance, I'll say it, is 12. It's extremely insufficient. And that's because I sit inside. I use my sunscreen. And I don't go in the sun at 10 a.m. with my top off, which is what you need to do to get enough vitamin D. Yes, knowing what your mineral levels are and replacing them is also important. Little things that we can do.
And I didn't actually realize that my iron levels were so low. I did get a test. And would that be just taking, especially for women, taking care of the iron levels as well?
We see iron deficiency extremely common in the perimenopausal group because they're bleeding chaotically of it, bleeding heavily, clotting, bleeding too frequently in a month, very short cycles. And we see those women actually become iron deficient and anemic. And then definitely they need, and there's some really good quality absorbable irons available on the market now. Postmenopausal women actually are less frequently anemic because they're not losing blood, they're not bleeding. And so for them, I think when there's fatigue, one would always want to test and make sure that it wasn't due to something else and perhaps discuss estrogen replacement therapy with them rather than just add iron in. I would be more careful in the postmenopausal woman who's not bleeding.
I need to, before we talk about strength training and mobility, I do need to touch on the collagen supplement, because there's always two sides to your story. I do take collagen. I've disclosed this. I've written an article about it with collaboration from different doctors.
Okay.
I believe that collagen does help as a supplement. The trials are coming in now. There are clinical trials. What do you think as collagen as a supplement?
Look, this has been studied, and it makes no sense coming to the answer, but theoretically and scientifically, it makes no sense that when you eat, for example, the heart of an animal, that it will break down into its component amino acids, and then the body will know to put those back together again and benefit your heart. It just doesn't make sense. It's never been shown to be the case previously when looked at. But what we do know is that for some other reason, studies done on collagen, even though it is an incomplete protein, it's deficient in 2 or 3 amino acids. They're not all there. And once it's digested, it is broken down into its component amino acids. And the body shouldn't really know to send it into the skin or the hair. Yet, somehow, there are benefits shown in studies across the board, actually, all over the place, that it has benefits on elastin, collagen, appearance of the skin, and potentially joints as well.
And I think my stance is that if it's not bad for me, I'll give it a go.
100%. I think that's right. Certainly nothing bad shown from it, except you've got to buy it. But
yes,
it seems to be beneficial. That's all I can say about it. Don't know why.
Going back to the active bone density and lean muscle mass that we do lose, and there is this condition called sarcopenia, which we all get, men and women, as you age, your muscle mass declines. What do you recommend that, say, somebody who hasn't done any exercise, can anybody start from scratch? Even a walk, perhaps, is beneficial.
This is a passionate subject. I love this. I think it's a very interesting one and a very important one too. And I think what's important to know is that the muscle is the armor of the bone. And bone density is a very important issue after menopause. But muscle itself confers metabolic well-being, mobility, stability. The problem is we fall about the place. We hurt ourselves, we injure ourselves, we fracture bones. And muscle condition is really important. Studies were actually done in frail care homes, in women over 80. And all they did was passively get them to contract their thigh muscles. And there were significant changes in mood, energy, appetite, cognitive functions, just from passively contracting thigh muscles over, I can't remember how long, but the study went on for possibly 8 or 12 weeks. We know that it doesn't really matter what age and stage you're at. Conditioning, moving, contracting your muscles is going to give you benefits more than just your bone density. It seems to affect the entire system and one's well-being in general. I would encourage it, of course, from young age and to never stop. And if you've got injuries, it doesn't matter if it's just a walk, although there's certain scientists I see that are saying that a walk is not a resistance training. And it's considered to be low impact resistance. So it's not nothing. But resistance training is really considered to be the gold standard for protection of muscles and bone.
Perhaps a good workout with weights twice a week, 3 times a week.
Yeah, absolutely.
Get some guidance. Know that you can lift heavy because it's going to benefit you in the long run. All right, I'm going to get into the HRT. My comparison is I've spoken to many dermatologists in my years as a medical journalist, and gold standard for good skin, good functional, healthy skin is retin A. And could I say the same for menopausal women who are struggling with many of these symptoms? Is HRT the gold standard?
Absolutely. There's been so much research and so much talk about this. And of course, because of the negative press that hormone replacement therapy received at one point, there was a lot of focus on alternative remedies to try and get on top of menopause symptoms, and none of them have been shown to be of any benefit. Estrogen replacement therapy is the gold standard to treat menopausal hot flushes, night sweats, genitourinary symptoms, and now it would seem many of the other symptoms that go along with those, like the brain fog and the aches and the pains and the mood disorders and sleep
and disease like dementia.
Yes.
What about getting help when there is a history of breast cancer? In the family, if your granny had it or your mum has suffered from breast cancer, then I want to go on to an estrogen replacement. What should one do there?
So I mentioned in your previous question, in answer to your previous question, that estrogen replacement is the gold standard.
Yes.
I should have added at the time that obviously that very much depends on the patient's risk factors. And I think there are certain patients where you've got to be very careful and perhaps they aren't suitable. And those are patients with an active estrogen receptor positive breast cancer or cancers of certain sorts, hormone-related cancers. Blood clots. And I think when it comes to finding out what your one individual's risks of going on to hormone replacement therapy, you would want to know what your clotting factors are. You would obviously want to consider if you'd had blood clots at any point in the past and how significant your family history of cancer is. Because our grannies at age 75 developed a breast cancer, and we know the real cause of breast cancer is age related. There are some specific genetic breast cancers that happen in young women, but the majority happen as a result of the aging immune system. Granny who was 75 and got breast cancer isn't necessarily a contraindication to your going onto hormone replacement therapy. That needs to be discussed with your practitioner, and obviously with all the specific tests, a mammogram and a really well-informed discussion with your practitioner would help you gauge what your risks would be and whether it would be safe for you to do it.
Right. Thank you for that. It's just going on with HRT and looking at the fact that women and men, but we're talking women's health. So women are living much longer now. And you can be active, joyful in your 70s, 80s, and 90s. You're a yoga practitioner. I'm a yoga practitioner. You strive for that peace and for the joy that the movement gives you. Is it worth looking at the daily investment in your health by going on to HRT at a later stage? Say you've missed out. Say you think, oh, I'm 69 years old. It's too late for me to go on hormone replacement. But isn't it?
So that is an important question, and the answer to it is given to us from a study called the Women's Health Initiative study, which was published in 2002. The study came out and the press got hold of the results and immediately published that hormone replacement therapy was bad for you, it causes cancer. And there was a huge, everybody stopped their hormone replacement therapy, and they didn't actually see a decrease in breast cancer in the following years. And so investigators went back to the study and mined the data and actually found that there was something that they've called the timing hypothesis, which is very important. If you go on to hormone replacement therapy, within 8 to 10 years of having gone into menopause, you are not necessarily going to be at risk for anything disastrous like a breast cancer. But that study did show that when women waited for longer than 10 years and were hormone free for that interval and then went on to hormone replacement, the incidence of breast cancer did actually go up. And there wasn't as much protection conferred on those women in terms of cardiovascular protection, brain protection, bone density protection. It seems as though the benefits and the risks of going on hormone replacement therapy after you've been in menopause for 10 years needs to be very carefully weighed up, because it may not be such an ideal thing to reach for, is estrogen, after you've had that 10 years or more gap of having gone into menopause.
All right. And then in terms of estrogen replacement, could you just take us through briefly what our options are?
In South Africa at the moment, we've got great products, and I think it will all depend on whether you've got a uterus or not. If you've got a uterus intact, you have to have progesterone with your estrogen replacement, and that's uterine protective. And you can do that in the form of patches or in the form of, or in an oral form or a tablet. If you don't have a uterus, there are gels, patches, and tablets, and different tablets, lots of different classes of them with different ingredients, different progestins, and different types of estrogen. So we've got quite a good selection here in South Africa, according to what your needs are and where you are in menopause.
Yeah. Well, thank you so much for all your advice. And I hope it was helpful to you, the viewers. And all I can say is with all the different options, and we were talking about grannies, our grannies didn't have all this knowledge. And we can certainly arm ourselves with everything that Dr. Fleming has told us and hope for the best.
Yes.